When stress levels are high, our body, secretes cortisol and adrenaline, and these two hormones can raise blood sugar levels. Only 28% of people in metformin group could prevent progression of their disease, while 61% of people in lifestyle intervention group they prevented progression into type 2 diabetes.
Today we have Dr. Vinita Singh with us. Vinita is a certified lifestyle medicine professional. She shows that lifestyle medicine knows no boundary because we are separated by continents but not by interest. Vinita started life not in the lifestyle medicine profession but in a dental practice or a dental scheme. And then she worked her way through being a commissioned officer in the army. And then at some point in time, she made a clear decision to switch her career. Today we are talking about diabetes, we're talking about diabetes type 1, type 2 diabetes, and everything that's related to that in regards to lifestyle medicine. So, Vinita, welcome.
Thank you, Johnson, and thank you so much for having me over. It's a pleasure to be here.
It's good to see you. Vinita, can we start by, can I apologize for my voice? It's a little bit hoarse today, but I thought it was so important that we do
I
that.
wish you a speedy recovery.
Thank you. Vinita, just give us a little background of who you are, please.
Yeah, actually, I'm a dentist by profession, and like you said all about that, I've had a very illustrious career as a dentist, as a practicing dentist. But then, all this while I was seeing something, I was noticing something, but I was clueless about how to address it. Like my father was, is, living with type 2 diabetes for last 25 years. On my husband's side, my mother-in-law has cardiovascular disease. She's been told to undergo an operation which she's resisting. My father-in-law died of a stroke, and likewise, and extended family members also either have a hypertension issue or they have diabetes issue. So we didn't think much about it, and we thought since we are, having this army background, so we were physically very active, exercising and going to the gyms, going for runs, marathons, and the works. So we thought we'll be safe and we will not, be caught by any of these diseases. But then I still remember the date. It was 12th of January 2017 when we got my blood reports, and it showed a completely different picture. It came as a shock, and I had serious health issues. I went to my doctor and requested him to give me some time to try out something other than conventional medicines, and he gave me a month's time. And I tried things. I don't know what worked because I spoke to many people. I searched the net, and I just tried whatever I could lay my hands on. I had a friend who was into, herbs and essential oils and energy healing. I tried even that. So I don't know what worked during that 1 month, but I recovered, I improved. So then I thought, I decided I want to, systematically study this. So India has, ancient medical practices, so which lot of people practice while in India, and so does China. China also has, lot of ancient medical therapies and practices. So I studied those therapies, those practices, and I did a diploma in holistic health sciences. Thereafter, I got interested in nutrition. I studied nutrition. I am a certified holistic nutritionist as well. Then I studied diploma. I did diploma in meditation also, but then finally the science backed and evidence based science about lifestyle changes which could be incorporated into conventional medicine was what I was looking for, and I got all that in American College of Lifestyle Medicine. So then I enrolled into their courses, and in November 2020, I certified as a lifestyle medicine professional. Now I am a doctoral member of American College of Lifestyle Medicine as well, and there are many doctors like me who are practicing lifestyle medicine aside their own, conventional specialties.
And it, I'm sorry to hear about all of the personal issues around you. And I guess for most people, that's the sort of thing that galvanizes you to change.
True.
Um, how is your practice viewed by the general public around you?
Yes, actually, that is quite interesting because mostly, in southern parts of India, lifestyle medicine is well known. There is a lot of awareness about lifestyle medicine. Whereas in North India, when I talk about lifestyle medicine, then people are like, oh, you're a dietitian. So I would say, yes, I deal in nutrition, but it is way more than that. It is also about, physical activity, about stress management, about getting a better sleep, and about social connectedness, emotional and mental health and wellness. That is what actually motivated me to start my, Facebook, page
Yeah.
where I post content in Hindi. Hindi is the native language in North India. So I post content in Hindi, thinking that it will, make people more aware about things related to lifestyle medicine and therapeutic lifestyle changes. So slowly it is happening. I'm getting a lot of queries. I keep getting a lot of calls, and people ask my guidance in different matters. So I think the scenario has changed quite a bit. Yep.
I think that's the big one, the education piece.
Exactly. Working at the grassroots level, that makes the change because, what I feel is one has to go out and meet people, interact with them, and tell them that this is also possible, alongside your conventional treatment. Also, do this because these chronic diseases always have this very strong lifestyle component. So, most of them are caused because of faulty lifestyle.
And I think that's important. Coming back to what you said at the beginning, is like there you are with an army lifestyle. You're going to the gym. You're
Yes,
doing your running. You may be lifting weights. You may be everything's active, and then you
true.
get this result that says, "Hold on, something's not right."
Yes,
So that's what I like about what we talk about in lifestyle medicine. It's the whole package, isn't it?
true. Very true.
Everything has some value. And so you can't just concentrate on one, but when you start to deal with the whole piece of it, then there's possibility of change.
Absolutely correct. Absolutely correct. Lifestyle cannot be classified as just diet or just exercise. So it has to be a combination of various things.
So if we start to talk to me a little bit about diabetes in particular, for people who don't know, just as a quick few sentences on diabetes, types of diabetes.
Basically, diabetes is something. Johnson, can you see me?
Yes.
Okay. Basically, diabetes is a group of disease that it's like it is characterized uniformly by raised blood glucose levels. Now, the thing is, there are when the blood glucose levels rise, then there can only be two things. One is deficient production of insulin, or something wrong with the cells that they cannot, uptake glucose out of the bloodstream. Because, see, in a healthy individual, what will happen is when a person takes his or her meals, the process of digestion starts, and carbs are broken down into glucose, and Proteins are broken down into amino acids, and fats are broken down into fatty acids for easy uptake, easy transportation of these molecules from through gut lining into the bloodstream, so that these can be transported to various cells where these will be utilized for their respective functions. Now our body runs on glucose. Glucose is the primary and preferred source of energy fuel for the body. And normally what happens, as glucose enters the bloodstream, glucose levels start rising. So the pancreatic beta cells, there are specialized cells in the pancreas. Pancreas just happens to be an organ. It has many functions to perform. One of them is a secretion of a hormone called insulin. So beta cells in pancreas do this job, and they start producing insulin in response to rising blood glucose levels. Now, this insulin is a signal for the body cells that glucose is available and it can be uptaken from the blood. Now, what happens in a person who is diabetic? Somehow, either this insulin signal is not strong enough because deficient amount of insulin is being produced, or cells refuse, don't refuse. They fail to read the insulin signal. This phenomenon is called insulin resistance. Now there are many reasons to this also, but then when this happens, then what happens, the glucose has to stay put in bloodstream only and levels start rising.
Yeah.
So this is basically what diabetes is. Now, based on what has caused this condition, there are many types of diabetes mellitus to be precise. So type 1 is the one in which insulin production is reduced to an extent that it is almost zero. And it is a progressive disease, and just beta cells start dying and insulin production just keeps getting more and more deficient. There is another diabetes type which is called type 1.5. This is latent autoimmune diabetes in adults, and this again has an autoimmune component, and because of which beta cell death is happening. Then there is pre-diabetes, in which blood sugar levels are high, but they are not high enough to be classified as a diabetic patient. And then gestational, which happens in pregnant women and it reverses once the delivery happens. Then there is another very common type of diabetes, which is type 2 diabetes. And almost 95% of people who have diabetes, out of those 95% people are type 2 diabetic. And type 2 diabetes happens because of both these things. Insulin production is also reduced and cells are insulin resistant. So this is how we classify diabetes and various types.
And I think most people would recognize that the problem that we face in the world is getting bigger and bigger.
Yes.
It's fair to say it's got to do with lifestyle, like you say, that we're more sedentary, or that we're getting, as a population, more obese, and
Yes.
that has a lot to play in the causation of these things. Is that right?
That's very correct. Actually, there are many causes to why type 2 diabetes happens. And some are behavioral factors, like you said, sedentary lifestyle. They just keep sitting for long hours and during their waking hours, and erratic sleep hours. Either they are sleeping very late or they are sleeping for very less number of hours. And, sleep is a restorative part in our daily cycle. It is only during sleep that the body recovers and rejuvenates and repairs itself, and excess fluid is thrown out. The toxic metabolic byproducts of a previous day are, the body gets rid of those things. So, if we are not sleeping well, then what happens? These processes are hampered. And these if we are not sleeping well, then these processes are hampered, and as a result inflammation rises, and this also is very harmful for the body because it can induce insulin resistance. Then excess calorie intake, eating ultra processed foods that have high calorie density and low on nutrition, these also are very harmful for the body because these cause fat deposition in liver and skeletal muscle cells. And intracellular lipid is the main driver for insulin resistance to happen. Also, other than these behavioral factors, unhealthy gut microbiome is also responsible for inflammatory cascade, and this can also result in insulin resistance. Then repeated bout of infections, any source which can cause inflammation in the body can lead any source of infection, any repeated episodes of infection may increase insulin resistance by activating chronic inflammation. And last but not the least, genetic component is also there. Some people are genetically predisposed to having this type 2 diabetes, and if anyone in your first degree relatives has type 2 diabetes, there is a chance that you may also, end up with type 2 diabetes. But then, like, people have clarified that your genes are not your destiny. Dr. Dean Ornish has proven it in his experiment with prostate carcinoma patients, that genes are really not your destiny. It all depends on how well you live and what are your lifestyle choices. So genes can be overpowered by your good, healthy lifestyle choices.
That's for me. That's a good thing to know. Because I think, yeah, so it's not inevitable. And I think that's important for
It is not.
to say.
Yes.
Just
Yes.
because it runs in the family, it increases your chance, but in fact, it is only one part of the whole picture. So here
True.
we are, and you're saying, well, there's if we just talk about type 2 diabetes as being um, a big picture, a big part of the picture, what does that
Yes.
cause people? I mean, so what if you have diabetes? Can you not just take some tablets and sort it out, or get some more insulin and sort it out?
L- Actually, this reminds me of a study which was done in 2000. It was published in 2008, and this was the researchers wanted to know if we tightly control A1C levels within normal range, we
Yeah.
control your blood sugar level in normal range through pharmacological therapies, then can we prevent cardiovascular diseases? And diabetes is a dreadful disease only thanks to its complications. So cardiovascular disease being among the most common and most troublesome one. So they did this study. It is a very famous study. It is called ACCORD study, and Action for Control of Cardiovascular Disease Risk and Diabetes. So the time duration for this study was 5 years, and they wanted to see that if A1C and blood glucose levels were controlled tightly within normal limits with the help of pharmacological therapies, is it possible for us to reverse or to prevent the cardiovascular disease risk? So the time given was 5 years, but this study was terminated within a span of 2 years or 8 months, approximately that much time. And the reason was that cardiovascular disease mortality rose so high in this experimental group. So
Wow.
this study showed that just with the help of medicines, it is not possible to put diabetes into remission or to reverse the disease, because there is a very strong lifestyle component in this disease when it as far as type 2 diabetes is concerned. We have to look into lifestyle factors. Only then, once you have corrected whatever lifestyle choices are poor in your case, so once you have rectified those mistakes, only then you can prevent pre-diabetes from progressing into diabetes, or remit your diabetes or reverse your diabetes.
That's so important, that study, because that landmark study
Yeah.
addresses what some people in the population would be saying. Yeah, doc, just give me the tablets. Just give me the insulin and it will be fine. And
Yeah.
you're saying, no, neither here, this study had to be stopped because it was showing straight away that
Yes.
pure control of insulin is not stopping you getting your strokes, it's not stopping you getting your heart attacks, it's not stopping you getting all the complications of diabetes.
Correct. Correct.
Um, So is it that we can actually reverse this? Is it that we can bring it back into remission? Is that what we're saying now?
Uh, it's yes. Here, I would like to mention an expert consensus statement that was released by uh, ACLM, American College of Lifestyle Medicine, and this happened in the month of May this year only. And this statement has been endorsed by American Association of Clinical Endocrinology, co-sponsored by Endocrine Society, and supported by Academy of Nutrition and Dietetics in US. And it says there are three main points to be considered here in this statement. One is, how do you define remission of diabetes, remission of type 2 diabetes? So they say if a person maintains A1C levels equal or lower than 6.5 for minimum 3 months, and without any help from any pharmacological therapy, no medicines taken, nothing, no other aid taken for controlling your blood sugar levels, so then this diabetes can be said to have gone into remission. Now, second point is, your diet can be the primary intervention for remission of type 2 diabetes. And third point about it specifies what kind of diet it is. So the third point says the diet that will put your diabetes into remission is low fat, whole foods, plant based diet with avoidance of animal products. And it also says, higher the intensity of your dietary changes, higher are the chances of remission and sustained remission of type 2 diabetes. So basically, it's telling us that diet is a very important component of lifestyle medicine therapeutic changes for remission of type 2 diabetes. But not just diet, there are several other things that need to be taken into consideration. Next, very important thing is physical activity, planned exercises, and stress management, of course. Because if a person's stress levels are high, someone living with type 2 diabetes and stress levels are high, then we know when stress levels are high, our body, secretes cortisol and adrenaline. And these two hormones can raise blood sugar levels. So, in type 1 diabetics, actually, it can sometimes lower your blood sugar levels dangerously. So it's like you need to manage your stress well, and MBSR, mindfulness based stress reduction. This is has been clinically proven to enable a patient to manage their stress well.
So that comes back to the whole picture again. It is more than the tight control. Just for anybody who doesn't know, what is HA1C?
HbA1c.
Yes.
HbA1c, actually it's a measure of for someone who's not from medical side. I would just say it's just a measure of last 3 months, whatever your blood glucose value was there. So it is just an average level of how much glucose you had in your blood for the last 3 months. So this measure is generally accepted as almost accurate. A function of how well your diabetes is doing, whether it is in control or it is uncontrolled. So 5.7 and below is considered normal blood sugar levels, and then 5.7 to 6.5 is pre-diabetes, and 6.5 plus is frank full-blown diabetes in type 2 diabetes.
And I wanted to highlight that part of the statement that talked about the degree in which you change your diet matters. So that if it's the bigger the change, the more likely you are of successful remission.
Absolutely, absolutely.
Can you expand on that in your experience? What does that mean to you? How have you seen that?
Yes. So, okay, I would give you an example. This is a very interesting question. It's a very good question. So I'll give you an example. Like for someone, uh, I advise dietary changes. I tell the patient that eat only whole grains. The patient is eating grains, but they're eating white rice instead of brown rice. So white rice is still processed, and then this will not be called an intensive change. Intensive change will be to eat only whole grains, which are least processed. So instead of white rice, I would say something like maybe brown rice or whole oat groats or quinoa. These are better options. And in place of flour, using flour products, made out of flour, which can be refined, or even whole grain flour, it is better to eat whole grains itself, least processed, minimally processed. But then what happens? Sometimes people are not able to do that. They don't like the taste, or they are taking long time to accept the new dietary pattern. So they are not eating well enough. They are not eating exactly whole plant-based diets. Now when you say plant-based diets, even French fries are plant-based food,
Yes.
and so is boiled potatoes. So somebody who's eating boiled potato will benefit more than somebody who's eating French fries. So that's how it is. Somebody who's having a salad of raw veggies and steamed veggies will benefit more than someone who shreds his veggies and makes them into fritters and then has it with store-bought sauce. So this is what
Yeah,
it is.
but Vanita, it's such hard work. Come on. And somebody would say, "Give me a break. Do I have to, you know,
But
up keep fit?"
rewards are worth it. Rewards are worth it. You will reverse your diabetes, and I've seen it happening. A few years back, this was around that time only in 2017, my father started feeling breathless. So since I was studying all this at that time, so I told him nothing doing. You do this, you take this, change your food, and I made a chart for him. You will not eat this. In place of this, you eat this. He changed all that, and otherwise he was heading towards hypertension, anti-hypertension medicines, but he never needed those medicines. He still maintains a very good blood pressure, and he also got rid of his diabetic medication actually.
Wow.
So, and at 83 years of age, that is remarkable. So, rewards are worth it.
So, how old was he when he started this change?
In 2017, this makes it about 5 years ago. So, around 77, 78 years old when he
So,
started these changes.
so you're saying a 77-year-old man can start to make these changes and see
Absolutely.
significant difference.
This is exactly what I'm saying. So these lifestyle changes are very powerful. I'll give you an example. There was in 2002, this program result was published. This is called National Diabetes Prevention Program. So in this, all the people who volunteered to participate were pre-diabetes. They were living with pre-diabetes, and the program was to see if lifestyle intervention can prevent pre-diabetes progressing to type 2 diabetes. Now, two groups were made. One was given metformin, and the other one was given your lifestyle interventions. So the lifestyle intervention group scored double, it was almost double. Only 28% of people in metformin group could prevent progression of their disease, while 61% of people in lifestyle intervention group, they prevented progression into type 2 diabetes. So lifestyle, therapies are extremely powerful if they are done, sincerely and in completion.
Yeah. So, I'm going to come back to, for people who don't know this term pre-diabetes. So, somebody goes to their doctor and the doctor says, based on your blood results, you are pre-diabetic. So somebody might walk away and say, the doctor said I'm not diabetic. Uh,
Yes.
is it that one will lead to the other?
That's what I'm saying. If you get to know that you are in that range, pre-diabetic range, and you do corrective lifestyle changes, and we actually call it intensive lifestyle intensive therapeutic lifestyle changes, ITLC. So if you adopt those changes, then you can be safe from type 2 diabetes in most people. This has happened. I've seen it happening.
Wow. What in your experience is some of the difficulties or problems for people to adopt this sort of approach?
In India, there is a process called tadka. So tadka, what they do is they need to fry certain herbs and spices in oil and then put veggies or pulses, lentils, whatever curry they are making, they have to give tadka. So this is a major roadblock that people face because making food, cooking their food with minimum oil or without oil is the biggest roadblock for people in my country. Once they overcome this mentality, this mindset that we can actually cook without oil, everything else is a cakewalk for them. They can, because in even otherwise, Indians eat very good food. They eat lots of veggies, they eat lots of fruits, lot of, beans, pulses, legumes, and grains also. And even, the other kind of grains, the healthier ones, millets and even pseudo grains. So the newer generations, they are even experimenting with these pseudo grains. They are experimenting with buckwheat, quinoa, and works. So the only roadblock is use of excessive use of oil, ghee, and butter. So once they overcome that, then everything else is very easy for them. And then another thing that I've observed is for women who are, basically what I call as homemakers. So for them, they think since they are working at home all the time, they are doing, household chores and they are doing laundry, they are doing cleaning, they are doing cooking. So they are busy whole day, they are active throughout the day. So they don't need exercise. So this is another mental block which has to be done away with because doing all these works doesn't exercise all your muscle groups. And if you want to keep safe from diabetes, a condition that has got a very strong, metabolism gone wrong component. So for this, you have to preserve your muscle mass to maintain your metabolism. And muscle mass preservation will happen only if you are exercising, you're doing strength training. It is very, very important for even women who stay at home. And actually for everybody, strength training is very important to preserve your muscle mass and to maintain your metabolism.
So let me just come back. Two really interesting points you've made there, but I want to drill down a little bit more into the oil, the ghee, and the butter.
Yeah.
So the oil is vegetable oil on the whole, but the butter is animal fat. So
Yes.
is there any kind of oil that is not associated with raising the risk of diabetes? What about olive oil, for example?
Olive oil has there are many kinds of olive oil: extra virgin olive oil, light, extra light olive oil for Indian cooking. But according to me, in as far as I understand, all oils are not good. Why have oils? Why can't we just have olives? Olives have fiber, olives have other phytonutrients, olives have so many antioxidants. They say in extra virgin olive oil, some amount of polyphenols are there. But then the thing is, for polyphenols, why shouldn't we go to the source? Have olives instead. Why should you have, oils? And same goes for coconut oil. Actually, in my country, in southern parts of my country, coconut oil is supposed to be very good, but then I would say it is very good for your hair and skin, but not for eating because it has a very high saturated fat content. So oils are not good for diabetes, for people living with type 2 diabetes or for people living with diabetes. It will worsen your insulin resistance.
That sounds like a big cultural barrier to get people to cook without oil.
Um, Actually, change will happen because now people are realizing that they have to do away with, so much cooking oil and so much fried stuff. Now people are gravitating towards steamed veggies and, steaming and boiling is the best way to cook your food. So now awareness is increasing actually. In India, also awareness is increasing.
I know, I don't know about India, but I can't think I would convince my Indian friends in the UK to have a curry without oil. How do I do that, Vanita?
Tell them it will cause them a lot of diseases if they continue, and if they stop they will be rewarded suitably with a long and healthy life.
But no, my question is, can you cook a curry without oil?
Yeah, sure, why not? you can
What do-
you
what
can cook.
what are you substituting for the oil then?
There are two ways of cooking without oil. One is water saute your veggies like I do,
Yep.
and then another way is to just grease your pan, dip dip the brush, that silicone brush, in the oil can, and remove excess oil and just brush your pan with that brush, and it will just leave some amount of grease so that the thing whatever you're cooking doesn't stick to the bottom, and then cook.
So
I've
instead
been doing it all the time.
wow, instead of like 4 tablespoons, I can just brush it on.
Yeah, or maybe just use a sprinkler. Just sprinkle small amount of oil, but best is water saute your food.
Yep. That would be really interesting to see how that transpires to change the culture.
Yes, actually, you know what? Cooking oil at beyond smoking point in any case produces a lot of trans fats. We know that,
Yep.
and cooking beyond 130 degrees Celsius, this also produces lots of AGEs, advanced glycation end products. So these are harmful in the long run. We know these are very very deleterious to our health. So cook without oil and cook at lower temperatures.
All right. I want to come back to the other point that while I remember it. So you're saying all these homemakers are there doing their chores, and I have to go and tell them that Vanita says you need to go lift weights now?
They should do strengthening exercises. There's no doubt about it. But then lifting weights is just one exercise for muscle strengthening. You can do so many things. You can do anti-gravity exercises, use your own body weight for exercising, for muscle training and strength training. And there are so many other things you can do. You can buy small weights, start with 2 kgs and dumbbells, and then 2.5 kgs, gradually increase your weight. Even at home you can do so many things which can strengthen your muscles.
I do like that idea of doing it at home. One of my own little practices is I put all the cans at the bottom. So
Okay.
I'm forcing myself to squat
Oh,
on a regular
okay.
basis.
Oh,
I,
amazing.
I'm
Yeah.
yet to convince my wife that I need to put all the plates on the bottom. But I think these sort of changes to our environment can make a difference.
Yes, that's very correct. Actually, it's kind of doing your household chores, and at the same time you are squatting, and you are when you rise you're using your own body weight. That's correct.
Yep. I even got some friends of mine to lend me their children. I said, come, we'll go brush our teeth and we'll squat while brushing our teeth. It
Yeah,
looked quite funny, but I think if you did that all your life, it would make a difference.
true.
Vanita, it's been amazing talking to you. And I think we're just about to run out of time. Is there anything that you would want to add that you think we haven't touched on so far? No. Okay. So just as we finish, Vanita, can you tell people where they find you online and what your professional activities look like?
Yes, I'm very actively posting on Facebook, and I have a page called Dr. Vinita Singh by my name, and there I post regularly. So they can visit that site. They will find, useful content, and I talk about various health conditions. I also give out various recipes, and mainly cooking without oil, and healthy food. How to combine various healthy ingredients and produce something that is delicious as well as health promoting, and other things also, small odd tips related to health and wellness. I just keep giving out. I'm also present on Instagram, and again by the same name, and on Twitter also. And my checking my credentials, they can visit my LinkedIn page, and I will give the links.
Yep, we will publish that in the description of today's chat as well.
Yeah. Yes.
Vinita, it's been great talking to you, and I hope you enjoy the rest of your evening.
Thank you so much, Johnson. It was great, and the pleasure was all mine. And I really had a wonderful time talking to you about my favorite topics.